Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. An elderly, frail woman is admitted to the ward following a fall at home. What is the most appropriate way to assess her risk of developing a pressure sore? A. PSST6 score, B. PAST score, C. MUST score, D. Waterlow score, and E. Honeywell score. Okay, this question is asking about the appropriate way to assess the risk of developing a pressure sore. And the Waterlow score is the most appropriate way to assess the risk of developing a pressure sore. Here we are going to explain about it. Waterlow score is used to identify patients at risk of pressure sores. Pressure ulcers. Pressure ulcers develop in patients who are unable to move parts of their body due to illness, paralysis, or advancing age. They typically develop our bony prominences such as the sacrum or heel. The following factors predispose to the development of pressure ulcers: malnourishment, incontinence, lack of mobility, pain which leads to reduction in mobility, and all of these factors predispose to the development of pressure ulcers. The Waterlow score is a clinical risk assessment tool used to evaluate patients' risk of developing pressure ulcers or bed sores. It was developed by Judy Waterlow, a British nurse, and is widely used in hospital and care settings. It includes a number of factors including body mass index, nutritional status, skin type, mobility, and continence. As we can see here, this chart is showing a Waterlow score. Patients with above 10 score are at risk of pressure sores or bed sores, and patients with 15 above score are at high risk of bed sores or pressure sore, and patients with 20 plus or score are at very high risk of pressure ulcers. And here we are going to explain grading of pressure ulcers. In grade 1, non-blanchable erythema or intact skin is present. Discoloration of the skin, warmth, edema, induration, or hardness may also be used as indicators, particularly on individuals with darker skin. As we can see here, we can see the grade 1 grade 1 bed sores or pressure sores. Here we can see non-blanchable erythema or intact skin. Grade 2, partial thickness skin loss involving epidermis or dermis or both. The ulcer is superficial and presents clinically as an abrasion or blister. As we can see here, we can see partial thickness skin loss involving epidermis or dermis or both. Here we can see the superficial ulcer which is abrasion, or maybe it was a blister. We can see the abrasion of the superficial skin here, or partial thickness skin loss. In grade 3, the patient has full thickness skin loss involving damage to or necrosis of subcutaneous tissue that may extend down to but not through underlying fissure. Here we can see full thickness skin loss involving damage or necrosis of subcutaneous tissue, but here, as we can see, the underlying fissure is intact and is not damaged. Okay, in grade 4 we have extensive destruction, tissue necrosis or damage to muscle, bone, or supporting structures with or without full thickness skin loss. As we can see here, we can see extensive destruction of their tissue. Okay, in this diagram, as we can see here, in stage 1, we can see, as we can see, their skin is intact with no blanchable erythema. In grade 2, there is partial loss of dermis and a part of all of the dermis and partial loss of all epidermis. We have loss of all epidermis and partial part of dermis. In grade 3, there is a complete loss of dermis and epidermis, and in grade 4, we have destruction of the tissue and bone, tendon, or muscle is exposed. Okay, here we are going to explain the conclusion of stages of pressure ulcer. As we said, in stage 1, we have discoloration of intact skin not affected by light finger pressure or non-blanchable erythema. This may be difficult to identify in darkly pigmented skin. In stage 2, we have a partial thickness skin loss or damage involving epidermis and or dermis. The pressure ulcer is superficial and presents clinically as an abrasion, blister, or shallow crater. In stage 3, we have full thickness skin loss involving damage or subcutaneous tissue but not extending to the underlying fascia. The pressure ulcer presents clinically as a deep crater with or without undermining or adjacent tissue. In stage 4, we have full thickness skin loss with extensive destruction and necrosis extending to underlying tissue. As we can see here, we can see full thickness skin loss and necrosis also is present. Management or pressure ulcers or bedsores. A moist wound environment encourages ulcer healing. Hydrocolloid dressings and hydrogels may help facilitate this. The use of soap should be discouraged to avoid drying the wound. Wound swabs should not be done routinely, as the vast majority of pressure ulcers are colonized with bacteria. The decision to use systemic antibiotics should be taken on a clinical basis. Example, evidence of surrounding cellulitis. Consider referral to the tissue viability nurse, and surgical debridement may be beneficial for selected wounds. Okay, this was a short explanation about Waterlow scores and stages of pressure ulcers. Thank you for your attention.